Hi, everyone. Good morning. Please kindly have your seats. Thank you. Okay, so it's an absolute pleasure to be here, and I appreciate the leadership of the Liberty Career Academy for finding me worthy to come have a presentation here today. I'm particularly excited having this discussion with us because this is something very apt and very, very important. Um, well done to you. For a good recap, I listened to the recap of yesterday's program, and it was nice to see that quite a number of you followed through. So today we'll be talking about drugs, dreams, and deception. How substance abuse derails lives. Um, like was said in the introduction, I'm a mental health person, right? So I deal with mental health. I deal with how we think, how our emotions work together, and we'll be seeing what can particularly derail us and make us not function properly the way we're expected to be in terms of drugs. When we mention drug, it's not paracetamol that we are talking about here. And we're not talking about flagyl or any drug that you use when you're not feeling fine. We want to talk more in depthly about something that is very common now in the environment, which has to do with people that smoke, people that drink, people that do use different substances of abuse. Um, let me give you, let me introduce by saying this, right? So I saw a guy. He's a 26-year-old guy. He was expelled from his university in his first semester. I was in final year. He was expelled. You know, they did a random search, and then they saw that this guy had different substances inside his room. They did a blood test, urine test, and they saw that he was smoking. And then they expelled him. So when they expelled him, I asked him, I said, guy, what do you think about this experience? And he said, chairman, smoke now cruise. Oh. Life is reality. Now I know the reality. Same thing happened with a girl too who attended a private university that I spoke to. And then she said, doctor, now I know better. I probably should not have started it. This topic is so hard because over time right now, when we talk about drugs, it is something very common. There's practically no street that you would get to that you would not see these drugs. I'm going to ask you to give me examples shortly, but I can tell you that this is my first time in this environment. But if I need to smoke and get these drugs, I won't spend 5 minutes, I'll locate a place because it is everywhere. However, we are bringing this talk for us to be able to realize that despite being everywhere, could it be problematic for me? Could it affect me? And could it derail my life? Now, before I define what these drugs are, can we just give examples of different substances that we may have heard people use? Or maybe we ourselves have probably used one time or the other, but we don't use again now. So please give examples of the ones you've heard. Marijuana. Okay. Cocaine. Eh? Indian hemp. Okay. Tobacco. Okay. Heroin. Okay. Which other ones? Baki. Wonderful. I like that guy. The one that said Baki understands street names. All of you are just saying the general names that we know. Which other ones do you know? SK. Thank you, my guy. SK. Loud. Very good. You are doing well. Ice. Wonderful. You mentioned something? Shisha. Beautiful. Very good. I like this. We know about these things. That's good. So, when was the last time you took SK? Yesterday. It's okay. No problem. Anyways, that's fine. I like the fact that you've been able to give me different examples, and I'll group them for you very soon. But it's just interesting to know that SK, Loud, Kolos, every one of them are all different brands of marijuana. Marijuana is the same as Indian hemp, but they are different brands. So there's SK, there's Arizona, there's Loud, there's Colorado, there's Canadian Loud. Even the Loud, there's even different strain depending on where it's getting from. The examples you gave are very beautiful and I appreciate them. And that shows that whatever we'll be discussing, I believe we'll get it more. Now let's look at it. When we say substance use disorder or a drug abuse, you see it is an addiction, it's a brain problem. Substance use is when you use these different things we mentioned, and then it leads to a chronic, long-standing brain disease. Now, for those that use these substances, it gives them pleasure, right? There's nobody you will speak to and say, chairman, why you they smoke SK? They will tell you that, okay, if you smoke SK, it will make you look calm. Then you can eat better. And the way you think, things that you can't think and understand, you understand more. You see them better. So they have a reason for doing what they are doing. When you ask somebody and say, chairman, why are you smoking cigarette? He'll tell you, when I smoke cigarette, that's when I can just relax from all the stress and tension that I've been having since morning. So they have a reason for doing what they do. However, does that make it right? And that's where we are going to, right? By the way, when you drink alcohol, it's also a substance for those that drink alcohol. Because alcohol in itself is something that leads to dependence. And where I work in the psychiatric hospital Yaba, you'll be surprised that we manage quite a lot of people with so many of these dependents. There's a word, we call it drug ward. People used to fight to enter that ward because there are plenty patients with drug use disorder. If we see 25 new patients in a single day, out of the 25, at least 15 is because of any of these drugs that we just mentioned. So alcohol, you see them in sachet, Abi, all those sachet one, they'll say, give me, tell me those names now. Thank God it is Chelsea, it's not Arsenal. Give me Chelsea, Abi. Which other ones have you heard of? Captain Jack. Fenu Jack. This guy really knows a lot, I need to speak to this guy. You were the one that said Baki. Now you know. Hey, somebody just mentioned Giacomo. Do you know Giacomo? Now, this is amazing. I need to bring some research papers here for you people to fill questionnaires. Are you serious? I didn't know you would know all these names, So you know Giacomo and you know Fenuja. That's good. You've done well. I know some of us are looking strange, like, which one is Giacomo again? Don't worry. It's good that you don't know the name. But it's also good that you know it for awareness sake, so that people don't just give you something. But yes, there are different of these substances, right? People also take alcohol, in the morning. They just have to tear the... Hello? Okay, they just have to tear the sachet, put it in their mouth in the morning and say, we have to drink alcohol for us to ginger. Have you seen people carrying cement and carrying all those big something, and then they've used tramadol or they've taken codeine, which are different substances that are bad to the health. Now, let's quickly go forward. The substance use cuts across different ages. There are those, as we have young people that use it, we have older people that use it. As we have pregnant women that use it, we have those that are not pregnant. We even have young people at the age of 7, 8, 9 who have started smoking and using these substances. So it cuts across ages. However, it is commoner when you are a youth, an adolescent just growing up. And I'll tell you why. You see, as we are like this, right? We are so young, we are young, but our brain has not fully developed. There are some aspects of the body, we call it frontal lobe. It's important for judgment. It's important for decision making. Because we are still growing, those areas of our body have not fully developed. And so when our friend says, let us explore and take this thing, Because those areas are not fully developed, we won't think it's true. And then we just say, okay, let's go. I want to take it too. Oh, let's go. Me too, I can smoke. And then you follow through. Because the area of your brain that should help with judgment, that should help with decision, that should help with executive functioning is not fully developed. And that is why when our parents are still molding us and saying, don't go there, don't attend this party, don't move with this person, we get angry as youths. We'll say, why is my mommy not wanting me to go? Why doesn't one want to go? But they know what they are doing because our brain is not fully developed. And so I just want to quickly chuck in that advice to say, just follow through. Let them help you till when you now become at least 2021, when your brain level is better developed to make informed decisions. So that is it. I also quickly need to mention that people also smoke because there is something called a reward pathway in our brain. So let's take, for instance, you did very well in your exams and I gave you 20,000 naira. Do you know that the next exam you will do, you want to do well, right? Because you know there was a reward the last time. Abi? In our brain too, if we eat, let's say I like jollof rice and I ate jollof rice, I'm so happy, I enjoyed it. My brain is going to release some chemicals called dopamine. And so my body is happy. Yes, the jollof rice was sweet. So the next time I want to eat jollof rice again because I like that release of the chemical in my brain. Same thing for those that smoke, that drink. When they smoke or drink, it releases some chemicals in their brain. When it releases it, they feel good. They feel happy. They feel pleasured. And so they want that experience again. So I've smoked marijuana, for instance, now. And when I smoked marijuana, I was able to think better. It's helped me quickly do something I wanted to do. I'm going to be like, okay, I like the feeling. Let me go for it again. Let me go for it again. And before you know what is happening, I keep going for it because it is giving me pleasure due to that reward center in the brain. However, the pleasure has complication. And that is where we are going to. But before we get there, I've explained to you why people do it due to this pressure. But let's think about it. Why do people start these substances? For instance, somebody says, oh, I've started using tramadol. I've started using cocaine. Why do people try it? Have you ever thought about it that, okay, why is my friend using? Why am I not using? So why do people start substances? What do you think? Peer pressure. God will save us. So this peer pressure is a serious thing. People could start it because of friends. People could start it because my friend is using, let me also use. Or you want to fit in. To say, Tade has said, if I don't start smoking, no, it won't be my friend again. And I like Tade because Tade used to buy things for me. So because of that, let me follow what Tade is saying. And you two, you now start smoking. Peer pressure. And we need to recognize that early enough in terms of the friends that we want in our lives. Selecting who is in our life as our friend. Some people will say, show me your friend and I'll tell you who you are. Right? You must select those that are very good, that will help your behavior. So yes, peer pressure. Another thing that makes people start is curiosity. Some people are just naturally curious. I've seen a lot of young people start substance because they're like, I just want to know what I'm managing a girl right now. She's 13. She's 13 in secondary school. Year 9. She's just so curious. She's like, doctor, can't you see now? When they do it, it comes from their nose. I want to just see it. Like, how does it feel? Curious. And she just wants to do it. It's not as if her friend is telling her to. And she's like, doctor, I saw some movie. When I was looking at the movie, they lined some white thing on the table and they were using credit card to align it together. And they would do like this. I want to try it. She's just curious. And because of that curiosity, she has started experimenting before her parents realized. So some people is curiosity. Some is what they watch. I just mentioned somebody through movies, right? And watch it and it goes. Some is because of their parents. You have parents that are drinking, parents that are smoking. And they look at it. We call that concept modeling. When you see what your parents are doing and you follow it. And you're like, oh, is there anybody smoking in your family? Say, I saw a patient on the island some days ago. I said, doctor, all of us drink in our family. My daddy, they drink. My mama, they drink. My sister. So what are you saying? We are drinkers, all of us. But the alcohol is taking is already affecting him that when we did his liver test, it was high. That the liver function was already getting bad. How did you start? My dad drinks now, so why can't I drink alcohol? So modeling, that's how some people start. So I've given you some areas. It could be modeling, it could be curiosity, it could be friends. It could be what we watch, what we see. All these things shape us. But like I said, because we are young and growing, our brain is not fully developed, so decision making is not apt. That is why you must watch who you relate with, and you must also go back to your parents to help guide you. So these are some of the reasons why people start this substance use. And that leads to problems. And like I mentioned earlier, there are different ones, right? Apart from the ones you mentioned, there are those we call depressants, there are those we call downers, there are those we call stimulants. You see people take ice, right? And then you just see somebody, all the teeth is black, all the lips are, why is it like this now? Taking ice. So there's something called ice, we call it methamphetamine, there's crack. And these things destroy. I can assure you for free, some of my clients that are on crack, the money they've spent on this thing is enough to build a bungalow. And I say, Chairman, since you started taking crack, how much? And it's expensive, right? I say, doctor, may I not lie you, I don't reach 25 million on crack. You see these different substances, they call them jumbo. They call this one, some are not jumbo. Initially, when Nigeria was good, 50 naira. But now, 500 naira is increasing in price. If you stay on the island, it's even more expensive. 12,000 naira Canadian loud in some areas. Some areas is as much as 30K, depending on your class. And they sell it to you. But it's draining the individual. So, people use these things for different reasons, like I mentioned. Some will say, oh, I'm stressed, that's why I'm using it. A lot of university students are influenced in school. By being in university, their friends are telling them, use it, it will help you to read. Use this, it will help your brain better. It is foul. Those things are not true. So people now use it. They get all this. How do we now know that they are getting dependent or addicted to it? Number one, anybody that is addicted to a substance never stays on one. If you ask them and you say, oh, doctor, I started just by dragging. I just dragged. Or they say kiss. There's something they say, I just kissed. And before you know it, from just kissing, which gave them a feeling, they now start increasing it. It becomes 1, it becomes 2, it becomes 3. That's what we call tolerance. So they have to increase the use to get the same effect that they used to take. Sometimes when they get so high on this thing, they can be anything. They can become destructive. You know, there's something we call withdrawal symptoms. When you use a substance, when it is low in your body, you start acting somehow. Like because the substance is getting low in your body, you start reacting somehow. So there is withdrawal. So you see somebody is just aggressive, so aggressive. And he's just fighting. And you're like, why are you aggressive? Why are you fighting? Why? Because he's already getting high or withdrawing from the substance. I've seen somebody that was so high at a point, and then he looked at his father and slapped his father. Because he was high. He became aggressive and just slapped him. When he now got calmer, you slapped your father. Really? Me? When did I do that? I can never slap my father. But you are high. People could get so high, if we could see some of the videos I have, they will be rolling on the floor. They don't know what they are doing. They've lost touch with reality. Somebody started having seizures, convulsing. And the mother was like, he has never had a seizure before. I don't know what happened to my son. I said, no problem. Excuse me with your son. I said, Chairman, you did take tramadol. Say, doctor, how do you know? Because you took it excessively. And then when you took it excess, it led to seizure. Say, please don't tell my mother. Oh. My mother is a pastor. Oh. They must not know in church. Oh. They will do this and that. But why are you taking the tramadol? So it could lead to different things when they are withdrawing from it and different problems. But let's move further so that we save time. Why some other reasons why people could go into substance use, which I will explain to you. Number one, it could be biological. Sometimes it could be genetic. Studies have shown that when a father drinks alcohol, the son has a 3 or 4 chance increase to also start drinking alcohol from a lot of research. So it could be genetic sometimes from some of these things. Sometimes it could be due to childhood trauma. Some children have gone through traumatic events in childhood. They've already seen their parents start fighting here and there. My daddy is beating my mommy. My mommy is abusing my daddy. All those trauma would now make them go to meet their friends and say, how do I cope? My house is so hot all the time. They are always fighting. And the friend will say, oh, they are fighting. Just stay close. You won't even remember what they are doing. Trauma. Some could be trauma from rape. And then it makes them go into substance. Another thing that could occur is dysfunctional family. And that is why, yes, we may be young, but we must be planning for our future to say, I would have a good home. Sometimes when the family is very dysfunctional, father does whatever he wants, mother does whatever he wants, it leads to the use of substance. Another thing is personality. Some people's personality are personality that are too curious. They just want to do and know what is, even what is not their business. Some personality disorders can lead to that. Some could also be failure. I've had people start substance use in university because they failed a semester. And they said, oh, I felt so bad after failing that exam and this and that. And my friend said, oh, let's go out together. And we went out and I took 1 bottle of Smirnoff. Smirnoff has just 2% or Star Radler. And from that one, it now moves to another thing. Right? And so it just started. That's how they started. I have somebody a bit elderly that started alcohol just because they said, oh, it's good for your, how they used to say it, it's good for your heart. A little wine. And then she just took it. And from there, she liked the taste. She enjoyed what she took. And she became a chronic alcoholic. So sometimes it could be due to failures around, social issues, parents not supporting you. So all these things could lead to it. But what are now the complications that can come from it? How can it derail us? How can it affect our dream? Number one, substance use can lead to mental illness. Like my Oga before mentioned that mad. Even though we don't use the word mad because we don't want to stigmatize our clients, but if to make you understand, it can lead to madness. Some of the people you see on the street that are tearing their clothes, talking to themselves and moving around is because of substance use. See, when you use substance, it affects the structures, the chemical in the brain. So as they are giving pleasure, they are also damaging some things in the brain. And over time, you will start seeing reactions. So a lot of them that they bring to us in the hospital, some of them are already very psychotic. What do I mean? They are talking to themselves. You are seeing them and you are not saying anything. And they are like, do you know, you are not serious. So a mad person. Why are you talking to me like that? And nobody is talking to them. They are talking to themselves. Seriously. And some of them are hearing voices, hallucination. Because they've smoked so badly, it's affecting their brain. And then you just see them. I was talking to one day, and then suddenly he stood up. And he stood up and he slapped me. I'm like, why did you slap me? He said, the voices told me to slap you. Okay. I'll not slap my own back, Abby, because it's occupational hazard. It's part of my job. I was calm, right? But I had to quickly call crisis. So say crisis come. Oh. There are people who call crisis personnel. Quickly come. Oh. Somebody has slapped me here before he beats me up. Yes. Now you can come and hold him, right? But he was hearing voices because he had smoked colos. He wasn't thinking straight again. And then he just started acting out. So some of them could be psychotic. Some of them, another mental illness, it could lead to depression. Just feeling sad, just feeling down, because some people smoke these substances. You hear people say, oh, I took crack because I was feeling down, and when I take crack, it just elevates me, it improves my mood. So depression could come out from it. Schizophrenia, like I mentioned, psychotic problems, aggression, fighting. Do you understand? So substance use can lead to mental illness. And once mental illness sets in and you don't manage properly, it can derail your journey. It can derail your life. I talk to some of these people that are smoking and they are looking at me and they are saying, Doctor, how far now? You look young like us now and you are doing well. I said, I should tell you the truth. I've never smoked anything in my life. Like never ever. Say, really? I say, yes. Because it helps you stay on track. It won't derail you. Yes, I know some people will come out and say, I've been smoking now and I'm still doing well. It's a matter of time, because you are damaging your body. If it is not mental health issue, you are damaging some other aspects of your body. So that's mental health problem as a complication. Other complications, there could be physical problems. People drink alcohol, right? And when they drink alcohol, liver problem could come up with that. Damage their liver so badly, damage their kidney. And then they start looking for kidney transplant or looking for how you can do dialysis. And one session of dialysis, until now, the federal government is in the 12,000. One session of dialysis, at least cheapest 60,000. And you do 3 times in a week. That's 60 times 3 is what? 180,000. Times 4 weeks in a month. That's how much you'll be doing every month for dialysis. So there could be liver problem, kidney problem. It could damage the heart from all of these things because of substance use. Now, there are people that also abuse what we call injections, right? Some people, IV. They'll just say, IV pent is also a substance. They give it inside their vein and then they pass out. It could cause a lot of problems, skin issues, reactionary problem. It could make their legs swell. It could damage their body. So the problem substance use give is much more in 1 million folds than the little benefit you think you are deriving at that point in time. It slowly damages and derails you from your path. I've seen brilliant students in a lot of because private universities, they do a lot of tests, right? So they bring them to us in the hospital and say, this one, they've suspended him for 1 semester or 2 semesters. Please help us rehabilitate him. It has derailed them. Students doing so well with good GP and then they start smoking and they are dropping down. And now they are now having carryovers. They can't graduate with their mates. Derail. Some even start from secondary school and they won't be able to make their work results very well. Derail. And so you see people with good dreams and aspirations, they are not doing well again. So those could be part of the complications from substance use. Now, in case there are people that are now saying, I've started using substance, so what do you people want to do for me? My daddy, when I was small, I'm from Niger Delta, South. We used to drink very well. Even during my naming ceremony, they put alcohol in my mouth. So that's what we do in our culture. You need to help yourself to know how you moderate this thing, either to stop completely or reduce it so greatly to prevent harm. For us as even youth, it is abstinence. Let's not go into these things. And for those that may have possibly started, you could still stop. Because it is better now than for you to wait for 2 years' time or 3 years' time. So that you can start stopping that thing and it will not derail you from your dream. Trust me, substance use have made people that are wealthy become paupers. Substance use have made even family dissociate from some people because there are people that have come for rehabilitation 5 times. We just keep admitting them. As you're admitting and discharging, they are going back to the bunker to continue. You discharge, they admit them again, they go back. Family is tired. So we don't want you at home again, no. Just keep him in the hospital. 2 years, we don't want to see him. They won't even come and visit. Because your family is tired. They don't want to be associated with you. And that kind of person, the dream is already off. So we need to be very conscious of this to say, I want to be a doctor, then I need to stay away from substances. I want to be the president, then I need to stay away from substances. I want to achieve this thing, then I need to stay away from substances. Because I can assure you, the problems associated is way greater than what you get from it. So what do we do for anybody that is there? We manage them. And there are people that we've managed that have come back to life and they've gone back to what they need to do. But the major thing is abstinence. If you cannot abstain, we do rehabilitation. Oh, some people come into the hospital, we keep them, they do a lot of therapy, we address the issues. Why are you using it? What made you start? What do you benefit? And they get better over time. They start living their life. They move forward. If it was a social issue, we address it. Is it my parents? Is it this? We address whatever issues that's been, and they get better. But I want to emphasize on prevention. Please, don't start at all. Don't start. Do you know they sell this thing online? You can order for some of these things. I won't tell you where you go and order for it. But you can order for it online. You need to be careful. When you go for parties, be careful. Be very careful. Right? So, what I need to tell you is we have to prevent. Don't take at all. Stay abstinent from it. It will help you. It will help your health. It would elongate your life. Some cancers are from substances. You smoke cigarettes, you have lung cancer. They put it there. Smokers are what? Liable to die young, but people still smoke. It's there. So abstain completely from it. Another thing apart from it is, please, in your local community, you can form a club, drug-free association. It would help you. And preach the gospel of abstinence, of drug-free society. And for whoever that is in it, you can still stop. I am not condemning anybody. I'm not judging anybody. You have your reason for starting, but you can come for help and let us help you stop this thing so that you will not derail your dream and your path. I'm going to round off here because I just want to take a few questions before I go, because I know that substance use is something that is very common. It's available, right? Somebody brought her sister all the way from Imo State, brought the sister to Lagos and said, this girl has been smoking so much in Imo. Let her come to Lagos where she does not know anybody. Within 30 minutes of reaching Lagos, the sister just went out to come back. She located where? And the sister met her at home smoking again. So it's everywhere. So don't say, oh, I'll run away from it. I will never. Yes, run away to not smoke. But also be wise enough to know that it is everywhere. Right? Thank you very much for listening. Let's take a few questions so that we can round off these things. Ask all those questions that have been bothering you related to substance use, and let us be able to trash them so that you don't go thinking that, okay, could this be there or that? Thank you.
All right, so if you have a question, just raise up your hand quickly. 1, 2, 3, 4. All right, we'll take the 4 questions. Come forward, please. Quickly. Oh, I counted 4, but there are 5 people. All right.
Yeah, thank you so much, sir, for the lecture. I want to ask about, you have people that also drink palm wine,
yes, palm wine
on the streets.
Yes.
And can you say there are effects on it, like can damage the liver also? And what are the effects of palm wine drinking?
Palm wine, Abi?
Yeah.
Okay, it's all right. You like palm wine? No, I'm just asking. Okay, so you want to say about palm wine? Yeah, next question.
Okay. So, good morning, Sarada.
Good morning.
I want to ask that you said alcohol and this thing, the rails are dream from where we want to get. So I want to ask that when one takes alcohol, like how does the brain function? Because I guess you're a doctor, right, sir? You're a doctor, right, sir?
Yes, I am.
So like when you take this thing, how does the brain, like how does it shapes, or does our brain remains the same, or does it changes?
Okay. It's all right.
So, good morning, sir.
Yeah,
I'm a university student, and I'm asking because, like, people that go for gatherings or parties or functions like that, is there any tips or guidelines that you could give to us so we can help avoid, like, substance abuse in those kinds of situations?
Okay.
Good morning, sir.
Good morning.
Sir, you talk about preaching the gospel in a way of helping those people who are addicted to it, then this drug abuse.
Okay.
So, how do you help someone that you are living with already and is ejecting himself every time and everything like that, but you are no more with the person, but you still have this urge of helping the person? So, how do you go about helping the person?
Okay. Thank you.
Morning, sir. My name is
Morning.
Divine. So I actually have 2 questions. The first one is that most of the times when you are talking with people, you tell them about drug substances and you hear them say like, oh, what about the likes of Burna Boy, Snoopy? I don't know if that's correctly. Also,
Yeah.
but they smoke heavily, yet they are still like in a good state. They're even looking fresher. than you and all that. They'll be like, yapping you that what are you doing? Like, what are you saying? Like, it makes you sound crazy because we don't know how these people are doing it. They even sing and they perform very well. They even look so healthy. That is my first question. So, like, what is the difference between them and those people that are taking it and like have gone mad? Yes. So my second question is that someone who talks to themselves, like actively engage yourself in personal conversations, you're speaking out loud with yourself. Is it a sign of mental illness or is it a normal thing? Because most times I engage myself in conversation, and most times my younger brother he does it a lot. My mom is like, "Oh, is he okay? Something wrong with him?" He's like on the laptop and he's talking to himself. He's relating with himself, having a conversation, and they're like, "Is anything okay with him?" But I'm like, I understand what he's doing because I do it too. So thank you very
Okay,
much.
that's fine. That's fine. Please appreciate everybody for wonderful questions asked. Thank you so much. Beautiful questions, and I will address them as fast as I can. So, in no particular order, let's start with the last one, right? If I have a fever now or I have an headache, let's say I have an headache, does that mean I have malaria? Thank you, because there could be several things causing the headache. Same thing when somebody is talking to himself. Talking to self does not necessarily mean, this person has mental illness. So, no. Do you understand? Before we say there's a mental health problem, there are a conglomerate of other questions we would ask, other signs and symptoms we will pick before we say it's a problem. Some of us talk to ourselves, right? We call it soliloquization, right? But when it now becomes so extreme and there are other things, that's when there could be a problem. I may want to come for a prep talk like this one now, and I've rehearsed with my mirror in my room and say, oh, when I get there, I'll first tell them this, I'll tell them that. I'm just prepping myself, right? So talking to self does not signify a mental health problem. Before it's a mental health problem, other things will come. Now let's go to Burna Boy and some other artists that smoke. You see, the truth about it is this. Everybody that takes any substance, ask them. There's something they believe they are gaining from it. And honestly speaking, it is not as if they are not. But it is about the complications that arise. It's just like saying, I can see my now, but I don't know the future. But I'm enjoying my now. Right? Again, you don't know your genetics or your family history. Somebody was complaining and say, my brother, he just started smoking 6 months and I'm bringing him to Yaba Psychiatry. Me, I've been smoking for 17 years. I've not gone to Yaba Psychiatry before. They are different. The genetics, what he inherited. Number two, how badly is he smoking? On a daily basis, this one is smoking once every month. I don't know if you get what I'm trying to say. Those people that you are seeing, some musicians will tell you, I've seen a lot of them, they'll be like, oh, when I smoke, it gives me inspiration for the verse. I'll be able to say, oh, Bese, Glory, this. Like, they'll be able to compose what they want. It gives them better, should I say, insight to it. But that is only then. What about the complications? See, these people may have pressure, but trust them. When they have complications, they are visiting us. Ethical issues will not allow me mention names, but trust me, currently I'm managing an artist. But to you people, they are singing, they are doing that. But you will not know. When he comes back again, he will drop another verse for you people, you'll be dancing. But they're having the complications. Do you understand what I'm trying to say? So don't just believe everything that you seem to see that looks so gloomy and glammy. Sometimes they go into hibernation and they are receiving treatment. But the song they have sung 3 months ago is still gyrating all over the waves and you think that they are doing well. Do you understand? So don't let them don't let them give you a false impression of you are doing well. I'll quickly use this analogy. Somebody goes to meet a babalawo and say, I want to have money. And he gives money. And you see the person having money now. You won't look at that money now because he still has complication in front of. But now it looks like he's very rich. But when he starts facing the problem, you may not be there. So be careful as to these people. They look fresher, but trust me, they may be going through some complications, right? And like I said, the complications are not only mental. It could be physical. They could have cancers. They could have a kidney problem. They could have a liver problem, which you don't know. Or they may be using drugs for it, and they are still looking better, but they are suffering from the problem. Thank you very much. Somebody with addiction, how do you help them? You must either speak to them and encourage them to seek treatment, or sometimes you force them when there are already complications. We see parents sometimes force their children to come to the hospital and they will bundle them and go and look for police or go and look for crisis personnel to bring them because at that moment that person does not see a problem. It is you that you are around that you are seeing problem and say, this person you have problem. You say, which kind of problem? Are they smoke? Are they catch cruise? I'm on trips. No, they may not see it as a problem. But it is you that would see. So sometimes we have to either encourage them to come willingly for treatment, or sometimes you force them, especially when you know that the complications are already setting up and it's getting bad and it's affecting their academics, it's affecting their physical life. Sometimes that is how you can help them receive treatment. Tips for parties. I mentioned earlier, show me your friend and I'll tell you who you are. Which kind of parties are you going to? Right? So you won't just go to any random party that you are not sure of where you are going. You won't just take anything from that random party that you don't know the content of what you are taking. So it is very important that you know the kind of parties you go to, you know what you are taking. It doesn't mean you don't socialize, but you are careful in what happens over there. Whatever goes inside of you is very important. I know palm wine is our local whatever. Some of the videos I was trying to show you, assuming my slide was showing, in the Niger Delta, South people take what they call, there's something called kai kai. Like they just take it, and it's just part of their culture. These things are alcoholic. Palm wine, when it ferments, is alcoholic. In fact, some studies have shown that its alcoholic content is even as greater because of that fermenting process. So the truth about it is, if we can avoid it, let us avoid. Let's take our water. Water is good for your body, plenty. And some of your soda that you take is also good for your body. We can do away with these things, live our lives, and let our eyes be on the prize that I don't want to derail my future. I have something I want to achieve. If this would affect my future, I will stay away from it. Thank you very much for your time. Thank you for listening.